Hi everyone, thanks for joining. My name is Ben, Community Lead at Ethnex. I'm delighted to have Pradeep Goel, CEO of the Solve.Care project. So thanks for joining us, Pradeep.
Good morning, Ben. It's a pleasure to be here, and thanks for having us.
Awesome. Cool. So I guess first question is maybe you can tell us a little bit about what Solve.Care is all about, maybe a brief overview of the project, some key achievements and latest progress.
Sure. So Solve.Care is a healthcare platform, and it comes out of the need to manage the three core pillars of healthcare. One of which is most familiar to people, which is clinical side. I go see a doctor, I need to pay the doctor, and I need to get care. But that's just the clinical element. There are two other really big tracks of healthcare that are behind the scenes, administrative in terms of how much I need to pay the doctor, what care am I getting, is it the right quality of care, and then payments. What's the right value of these services? Should I be paying this amount or a different amount? Am I getting the right level of benefits? So there are really three pillars of healthcare: clinical, administrative, and financial. And healthcare is complex because most people don't understand the underpinning of how this whole system works. And because we're disengaged from that process, we tend to complain about high cost and lack of availability, but really there seems to be no resolution to it. So Solve.Care platform is designed to address all three pillars of healthcare. And the origination of this is because I've spent 25 plus years in healthcare from all three angles. I've been a healthcare insurance executive. I've been on the public program government side, writing healthcare policy. I've been in the healthcare IT, building large complex backend systems. And I've certainly been a parent of a child that needs a lot of healthcare. So I had the opportunity to look at healthcare from all dimensions, and I realized that there is an opportunity and a need, and indeed an imperative, moral and professional and economic imperative, to address this issue in the US, in Canada, in Australia, in UK, all over the world. So that global perspective, that very 360-degree view of healthcare is what brought me to saying, we have to do things differently. We can't keep talking about it. And now is the right time, and now is the right technology available to do this.
Awesome. That sounds really good. Yeah, I think healthcare is definitely one industry that could really benefit from blockchain. I guess from your experience, what would be what's the biggest issue at the moment with those three pillars that kind of blockchain can help?
So fundamentally, healthcare is a team sport. When you go see a doctor, you're not just seeing the doctor. You have someone making an appointment, someone billing the insurance company, someone doing medical records, someone waiting for and reconciling the prices with the insurer or with your employer or with you. Someone's doing a referral to a specialist. Someone is coordinating the care between the primary care physician and the specialist. It's a team sport. And today we do this in a very strange way. What we do is we essentially rely upon email, phone, chat, personal effort to coordinate care, because everyone has their own worldview. You have the primary care physician or the GP who has their own systems. You have the insurance company with their own systems. You have your employer with their own benefit system. You have the government with their own benefit management and public program systems. And you as a patient, I don't think you have a mainframe in your living room coordinating all this care. I don't know of anyone who does. But that's practically what we need as a patient, to get all these parties to talk to my benefit, to my best outcomes. And that really doesn't happen. So we are essentially, as a parent, or as a patient, as a husband or as a father, you are sort of peering in through a window into this castle called healthcare, where you're hoping all the parties are talking to each other and somehow coordinating to your best value. And that doesn't happen. It's not because people don't want to give you the best care, it's because it's too complex. Yeah. So we need to think about healthcare, not just in the context of medical records, in the context of care coordination, benefit coordination, and payment coordination. How do I get to be the part of this journey that is all about me, but I'm not participating in it? So the value of blockchain, or really any decentralized technology, was very clear. If we use the blockchain as a coordination fabric, and then we coordinate benefits, care, and payments on it, then I, as a patient, have an equal role. I have an equal say in what happens, how happens, when happens, and so on. So why don't we use the blockchain as a decentralization of my role, my relationships with patient, as a patient with doctor, as a patient with employer, as a patient with my family members. So we saw this as an opportunity to truly bring the patient to the back of the center of healthcare. And not to do it just for clinical, because if you do just clinical, we will again miss the boat. We will again say, well, why isn't healthcare working better? Well, it can't work better if you only solve 1/3 of the problem. So we decided to address the three core tracks of healthcare: administrative, financial, and clinical, and to use a single chain and you as a participant in the chain, not as an observer, to be the center of this gravity. So that's the vision behind it.
Yeah.
And it works, because I can see as an insurer why I would want to use the chain to the benefit of my members. It reduces my costs, reduces my overall friction in the system. I can see as a doctor why I would use the chain, because I can deliver better care. I can see why as an employer I would use the chain, because I can give better benefits to my employees, keep them healthier, and keep them with me. And then as a patient, certainly want to use a chain because I want to take care of my son better or my mom better. So those are really the drivers behind Solve.Care.
Nice. I think you answered a couple of my questions in that one answer, which is great. But I think, yeah, it's a really good point. There's all these different players in what is essentially supposed to be a team cohesive process. And yet they all act somewhat independently, and they rely on mediators of trust in between, or they don't or aren't able to efficiently keep records and whatnot, causing issues for patients. And definitely one area where blockchain and decentralized technology can truly make a real difference. I was at a conference recently. I think someone gave an example of when, you know, all their records are in the UK. They went to the States and they had an issue which wasn't solved, wasn't taken care of properly, because they just couldn't access that data, even though they should theoretically be able to do so. Mm-hmm. But there's all these friction points, and it doesn't currently work well. So I think blockchain is definitely a real benefit to that industry.
Absolutely. And if you go beyond the clinical records, even if you could have brought your clinical data with you, when you go back to UK, you have care continuity issue. You have benefit continuity issue. Your insurance company may actually be responsible for paying your bill while you were in the United States. But to coordinate that benefit, that's what it's called, coordination of benefit, would be so complex. You as a patient will say, you know what, forget it. I'll just pay for it. That's not right. And literally hundreds of billions of dollars are spent on coordinating benefits around us, which are very, very complex. So it's really team sport around care, team sport around benefit administration, team sport around payments. Another example is healthcare payments. I go see the doctor, my insurance company pays the bill, and then some of it I have to pay at the end because they don't cover the 100% of the bill. And then the doctor is chasing me, the doctor is chasing the insurance company 90 days after they saw me. Where else do you go to the store, buy a sweater, and then 90 days later the store is coming after you to get paid? Yeah. That's not, and then three parties are involved. Some want to pay all of it, some want to pay part of it, but that's the way healthcare payments work. So it adds to cost. When we talk about why is healthcare so expensive, it's not just because clinically expensive, it's also administratively very expensive. Yeah. And then there is fraud, there is waste. In the US alone, we estimate that almost $1 trillion a year, think about that, 1,000 billion a year are lost to either fraud, waste, or overutilization. That's a staggering number, you know, and that's just one country. And when people say, well, that's just US, that's not true. The same percentages exist in every country, you know, in terms of whether it's overutilization or it's overpayment or it's overbilling. Those are all things that happen everywhere. Yeah. So we are addressing this as a universal problem.
Yeah, it's crying out for change for sure, especially in a globalized world. Well, yeah. So, something in my throat, sorry.
No worries.
Cool. So perhaps you can talk a little bit about how the project Solve.Care is gaining traction at the moment. Maybe legally you can't talk about partnerships, but if you can, please do. How you guys are building utility, what key releases you've made recently?
So I'm very pleased with the progress. So we're a little bit over 2 years old now, but I've been in healthcare for 27, 28 years now, probably approaching 30, although I shouldn't admit that. This is my fifth healthcare IT company, so it's not my first go around. And my belief is very simple, you know, have a clear understanding of what the problem you're solving, have a clear plan, and then execute relentlessly. And that's how we built Solve.Care as well. And then we also are a very conservative organization, even though we are in this new wild world of blockchain and crypto. Healthcare is a very conservative institution around the world. Yeah. So we have to be very compliant. We have to be very methodical in our approach. We cannot make promises and not deliver. So with that background, we've been doing an extraordinary job of executing. So our platform was built and launched in the first 12 months of the company. We signed a major client called Arizona Care Network, which is part of Dignity Health Systems, which is one of the largest healthcare systems in the United States. They practically serve 1 out of 4 Americans annually. So if every patient that goes to see a doctor, 1 out of 4 in the US end up at Dignity facilities. So it's a massive organization, and we are very proud to launch there. We've already issued a digital currency on our platform that is being used today to pay doctors millions of dollars. So it's addressing one of the most complex payments, which is value-based care. So value-based care is actually paying the doctor not just to see you, but to get you better. So we actually measure whether the doctor did a great job and pay them less or more depending on how well they took care of you. Not just you go see the doctor, you pay them $50. It's about, did the doctor take care of the right prescription? Did they give you the right guidance? Did they give you the right amount of time? Do you feel satisfied at the end of it? And that's a very complex payment model because you have to measure all kinds of metrics. So we're doing that today and successfully. On the to be announced side, we are doing some really significant new client. I don't like to call them partnerships because clients are actually contracted entities who pay us. And the way our platform works is that you launch care networks on our platform for your audience. If you're an insurance company, you built a network for your insurance members. If you're a hospital, you build a network for your patients. If you're a government agency, you build a network for your citizens. If you're an employer, you build a network for your employees. But what you deliver through our network is the same thing: access to care, quality of care, payments for care, coordination of care, coordination of benefits, all those things that cost a lot of money. So we are launching different kinds of care networks already in the market. So as I mentioned, first network has been up and running for over a year, which is the Arizona Care Network of provider payments, or physician payments. The next network we're launching is around diabetes care, and we're launching other around cancer care, around insurance benefits. So it's all coming in a cascade. And we are dealing with global organizations, not local organizations. So we have exceeded our own projections by a long shot.
Nice. Sounds like you're quite far down the road. So you're more than just an idea on a piece of paper. You've come a long way. You've got a holistic platform out there that is dealing with some big names and numbers. That sounds really good.
Yeah, and as an example, we have partnered with Lyft as a transportation provider, which is the second largest ride-sharing company in the US behind Uber. And that allows us to get the patients to the doctor's office on a timely basis. And either the patient or the family members or the doctor or the insurance company or the employer can pay for the ride. We can make sure the ride indeed happened on the right day, at the right time, from right point to right destination. So we can manage a lot of transportation related barriers to care. So that's an example of a partnership. And obviously for them to sign up with us, we had to pass a tremendous due diligence with them. And our clients are very excited about using transportation now as a key benefit. So not only do they want to give you an appointment with the doctor, they want to make sure you get to the doctor, because not going there will not make you better. And if transportation is a barrier, the insurance company can step up and pay for your transportation to ensure you get the right care. So we are embedding some really powerful new third-party services in the care wallet, in addition to the core care management.
I think that's very innovative, those progressive approaches, not just with the transport using Lyft, but also paying doctors based on how good they do. I imagine that's hard to measure, but ultimately if you can incentivize good practice, which I don't think much really happens at the moment, then that's definitely going to help change the healthcare system.
Absolutely. And this is a phenomenon that's happening everywhere. Paying doctors for quality is not just it's a new phenomenon. It's spreading like wildfire, to use a cliche. We were talking to one of the Middle Eastern Ministry of Health recently, and they have decided that they will move their entire country to value-based care in the next 5 years. Nice. Imagine that in a country of about 35 million people, every single physician will be paid on a value-based care model like ours. So we are heading there soon to speak with them to see how they could adopt our platform at a national level. So there's lots of opportunity around the world.
Yeah, for sure. That sounds really good. You mentioned that you issued a token to pay doctors in, and you've issued millions worth of them, if I'm not mistaken. Maybe you can talk a little bit more about the role of that token in the ecosystem in that context, as well as any other that might exist.
So Solve token is actually quite multifaceted, and we like to call it's a dual form token, waveform and matter form, in the sense that it's a utility token for our platform. So anyone who wants to sponsor a care network on our platform, be it the insurance company, be it the hospital, be it the employer or the government agency, if they want to sponsor a care network on our platform for their patient, for their employee, for their citizens, for their plan members, they need to have Solve tokens to pay for it. So that's fundamentally the utility value of the token. It's the platform access fee.
Mm-hmm.
And the token must be bought in the market. We don't sell these tokens. The tokens must be acquired in the public market and paid as platform subscription fees.
Cool.
Now, the second part of it is it can also be used as a payment token in the network. So when you launch a care network, you can then allow that token to be used for payments as well, which means you can give it to doctors or to patients or to a pharmacy or lab or transportation driver as a payment. And you have the ability as part of the network design to decide if the token inside the network as a payment currency is stable or variable. And most of our clients opt to use the token stable form inside the network. It's still variable before it enters a network and when it exits a network, but inside the network boundary, the client has the option of having it variable or stable. So depending on who the network sponsor is and their risk tolerance, you can either have Solve be completely variable from entry to exit, or you can have it variable till it enters and variable again when it exits, but stable inside. And that gives us an incredibly powerful mechanism because we can address a government agency's model might be different than a private insurer's model. A cost-sharing model for a hospital is different than that of an employer. So we truly can now address every model of payment that exists in healthcare because we designed Solve to be this dual form token.
Sounds like a very prudent approach, especially in this industry when there's where there's various different needs from clients and stuff.
It is. There is variation, right? I mean, fundamentally, there's always a care receiver, there's always a care provider, and there's always a care payer. And then in most cases, there's also a care regulator, an auditor or regulator, someone making sure that my patients, my citizens, my employees aren't being taken advantage of, or they're getting the right care from a quality perspective. So there's always these four entities, whether you're in China or in Cambodia or California, it doesn't matter. You're going to have a patient, provider, payer, and regulator. And what we designed the network to be is to allow any of those four entities or all of those four entities to participate in the network with the right role. And then based on their roles and their risk tolerance, you can design the behavior of the Solve token to be fixed or variable inside it.
Awesome. Sounds really good. So I guess jumping on to the next question, maybe you can talk a little bit about, are there any other projects in the space doing something similar? And sort of, if so, sort of what puts Solve.Care in the different leagues to your competitors?
So there are lots of healthcare companies on blockchain that are doing some really good work. A lot of them tend to be around, in fact, most of them tend to be around clinical record management or around the fundamental one or the three tracks, right? Either you are primarily focused on records management or you're focused on, very few are focused on benefit administration, even fewer are focused on financial. But nobody's doing all three tracks that we know of and that have designed a healthcare platform from the ground up to address all three pillars of healthcare. But we are very excited about some of the innovative projects in healthcare that we can plug into one of our three tracks. So if somebody comes up with a brilliant idea around record management that truly leads to mass adoption, they would be a perfect partner for us. If somebody comes up with a really great mechanism to measure quality of care, we can plug them into our second pillar. If we end up with someone with fantastic telemedicine solution, teleconsult, telehealth, telemonitoring solution, we can plug them into our third pillar. So we see ourselves as a platform of platforms in many ways, in that we bring the entire participant ecosystem together. Then if you have a great service to offer, like Lyft or like the online pharmacy or telemedicine or telehelicopter, let's see what the world develops. We are going to plug them in. So we are very keen to see the healthcare ecosystem on blockchain develop. But as far as execution is concerned, we think we are far ahead of anyone else. Our size of our clients, the revenue that we are generating from paying clients, the adoption levels that we are seeing, we don't know of anyone else yet.
Cool. So it sounds like the major difference would be the 360 holistic approach, of course, as well as how advanced you guys are at the moment.
Yeah, we certainly have the first mover advantage. When we started 2.5, 3 years ago, I started to talk about how we can use blockchain as a coordination fabric. I got the blank stares. What does that mean? What do you mean coordination fabric? It's a currency. Yeah. And I started to say, no, if you think about currency as only one modality, if you think of care coordination, benefit coordination, payment coordination as a core capability of blockchain, as that fabric that binds all these disparate entities, we can redefine healthcare. It was met with a with a lot of skepticism. Now now everybody's talking about what we're doing, but we started 3 years ago and we've been executing. So we have the first mover advantage. I'm very proud to say that. And we will maintain that by working harder than everybody else. So we will continue to execute. You can't stop and relax. You must continue to lead. So in that, and it'll be hard for people to catch up, but eventually the industry will mature and we will see more and more partners enter our ecosystem saying, I have a great product on blockchain. I need a distribution channel. Why can't I plug into Solve.Care platform as the distribution channel? And that's our vision for the platform.
Yeah, I think having that open source or sort of open door approach, inviting people in if they've got great, plugins and products, is perhaps, not only does it fit in with the blockchain ethos in general and the decentralized promises, but it's good for the future, right?
Absolutely. And as an example, we are working with an IoT blockchain that we will finalize and announce, where we want wearables that people want to wear. And they're different in the US versus, say, in Asia. People have different wearables, be it heart rate or blood pressure or blood glucose or BMI, whatever those are. Their devices are coming out and they are evolving rather quickly. And we want to be able to allow for every regional preference of devices to be able to feed data into Solve.Care platform, into the Care wallet as a Care card, so that my doctor can actually see visually and quickly what has been my heart rate over the last 90 days when I saw him last time. So the objective is to truly bring in patient supply data with clinically available data to the physician, as well as benefit data to the insurer and the financial data, and bring that together into a single administrative fabric, but still maintain privacy, right? I, as a patient, am not happy if my data is publicly consumable. So I need to give consent. I need to monitor consent. I need to take away consent. Great, you can do that through Care Wallet and Care Cards. In fact, blockchain, in some ways, while it's very open, can be a wonderful tool and is a wonderful tool to manage consent and privacy and security and my rights. So as patient rights management is actually a very powerful tool. And we're building that into our platform as well.
Nice. And okay, maybe like second to last question, just in case I've missed anything my end, perhaps, maybe you can share a little bit more about Solve.Care and blockchain and the merging of the two industries. If there's anything else to add on that point?
So I think if you think about the approach we're taking, we're using blockchain as the decentralized fabric, as a coordination fabric. On top of that, we built a platform which includes privacy management, consent management, relationship management. And on top of that layer, the Care protocol layer, we built Care wallets, which are meant to be a wallet that stays with you for the rest of your life, regardless of whether you change insurance companies or change jobs or change cities or change countries. The Care wallet stays with you as your personal healthcare app. And within that, we can deliver highly personalized care cards that are issued by the network you join. So today you might be a very young and healthy, as a young and healthy person, all you have in your wallet is the cards related to staying healthy, staying fit, sleeping well. But later in life, you might end up with certain conditions you need to monitor and prevent, like diabetes or heart, blood pressure, whatever. So we see the Care wallet evolving with you as you evolve as a human being. When you end up with kids and family and prescriptions and other needs, the wallet stays the same and the cards simply change. Meaning you join different networks and you get different cards. So in that regard, it becomes truly patient-centric philosophy that lives outside the control of a single employer, single insurer, single country, right? You can be anywhere, you can work for whoever. And that's a very inspiring vision for me, because I travel a lot around the world. Yeah. I've lived in many countries, I've built companies in many countries. And for me, this geographic definition is not applicable to me as a human being. Yeah. It's only applicable to the healthcare system. Yeah. So why do I have to be defined in the context of a healthcare system? So that's our vision. And I'm very proud to see it take form. People are really jumping on this. We are talking to some multinational insurers who sell insurance in dozens of countries, and they are realizing that they have a very silo view of their members, and with our platform, they can have a truly lifelong relationship with their members.
Nice. Yeah. I think that that traveling aspect is probably replicated amongst many people today. It's a very globalized world. You need access to healthcare wherever you are.
Yes.
Yeah.
And even within countries, right? You will switch employers, you'll switch cities, and in many places, healthcare always is very regional. Even if you have a the idea of a single government-sponsored healthcare system, you still have regional play. You have a regional hospital network. You have a regional, you have regional capabilities. So you're not going to truly have a global view of healthcare unless you are the global entity, which is the patient. So to us, instead of trying to connect all the back-end systems and waiting for nirvana, when all the back-end systems of hospital, doctor, patient, insurer, employer, government will connect one day, which is eons away, why don't we make the patient the actual connection point? That works a lot better. And that's where blockchain becomes really powerful. It's my chain, you can join it as a doctor, in effect.
Nice, very nice. Cool, so I guess last question, I'll let you go. Maybe you can point people in the direction of how they can get involved with Solve.Care, whether you're a client or an end user. What are the key places to go?
So there are lots of ways to get engaged with Solve.Care. So first is that our community is very vibrant. People are talking about Solve.Care, engaged in all kinds of wonderful ideas. We get care card ideas every day from our community. Some of them are physicians, some of them are pharmacists, some of them are surgeons, some obviously patients and parents and children. We have a very broad community, and that's a lot of that is active on the Telegram channel. So we certainly will encourage you to join it and join the dialogue. We also have periodic events where we are launching care card contests to design great new care cards. And we had a brilliant idea from someone recently about managing water intake and tracking how much liquids am I drinking. And so they're designing a care card. We're sponsoring it for them. So there's lots. So if you have ideas around how you can improve healthcare for yourself, for your parents, for your kids, and you feel that a care card could help deliver that value proposition, come to us. We're very interested in hearing new ideas. Then we have lots of partnerships being forged around the world. Lyft is just one example. We have literally dozens more coming in terms of partnerships. So if you have a service you want to offer as a company, you have a great service that would benefit the patient or the doctor, then come to us. We will talk about plugging that into our platform. And then finally, as a business entity, we speak at a lot of conferences. We have tremendously active conference schedule around the world. We're not just speaking in the US. I was just in Seoul, and before that I was in Hong Kong, and we're heading back to Tokyo. So there's a lot of participation Solve.Care is doing in healthcare community around the world. Come see us at any of these conferences. Send us an information request at info@solve.care, and we are monitoring that email and constantly replying. So there are many different ways you can talk to us, and we welcome that.
Awesome. I'll put all relevant links to what you've just mentioned in the description. So if anyone wants to follow through, you know where to go. And yeah, I think that covers it. Thank you very much, Pradeep, for your time today. Really appreciate it.
Likewise. Thanks for having us, and have a great day.
Thank you. You too. See ya.
Bye.